From carefully following accounts in the register over the last couple of years, it appears to me that no one really has a handle on the truth behind whether the conversion of Iowa's Medicaid program to a privatized operation has resulted in an improved program or not. That former Governor Terry Branstad at the time neither sought legislative input nor produced hard data supporting his decision was a warning omen. Since the initiation of the privatized management of Medicaid, Iowa's Department of Human Services and the private managers of the new system have occasionally released various figures purporting to demonstrate program success, but since the numbers are not based upon, nor backed up by, comparable performance measures over time, it is really impossible to know how to assess this experiment. As a former legislator, I am especially discouraged by the repeated failure of the legislature to press for the kind of hard data that would allow us all to understand the obvious difficulties and possible successes of this privatized program. It is imperative that the current Legislative Council take steps to gain access to the kind of hard data that will allow legislators to assess whether or not further action on their part is warranted. What are needed are such apple-to-apple comparisons as administrative costs of the program before and since privatization, data tracking on quality issues as number of citizens served, efficiency and adequacy of services provided, including response time from initial request for coverage to provision of coverage, citizen-provided assessment of satisfaction with coverage adequacy and timeliness of services, and lag time between receiving bills from providers and data demonstrating how and where alleged savings from conversion to privatization occurred. It is possible that Branstad's decision was the correct one. It is also possible that it was not. Frankly, at this point, no one appears to really know. The purpose behind getting this much-needed hard data is not to fix blame or to engage in pointless ideological battles, rather, it is because elected officials, and the citizens who select them, have a moral obligation to ensure that some of the most hurting among us are receiving the health care that they were promised. If some fixes are necessary, whether large or small, then let us get to it. This is not a Republican or Democratic issue. Proposed solutions should be, it is hoped, bipartisan. I pray current legislative leadership is up to the task. Greg Cusick is a former member of the Iowa House of Representatives. He retired as benefits administrator of the Iowa Public Employees Retirement System in 2004. He lives in Portland, Oregon. Greg Cusick, photo, special to the Register. Read or share this story. https://dmreg.co/2elmja